Hi, my name is Dr. Alex Guzman, and I am a pediatric physical therapist. In addition to becoming a physical therapist, I am also a kinesiologist, which means that I study the movement and also the muscles involved in the movements that the patients are doing. The people that I work with to figure out the plans to handle a patient is a pediatric orthopedic surgeon. Basically means that the orthopedic part means that they take care of the bones and see how they can realign or readjust the bones. The reason is because I work with them is because just in case the patient has to go through surgery, we discuss what can the patient do after the surgery right away so we can get them back to their daily life. A lot of the patients that I see are athletes that go through some injuries, but also I see patients that go through simple fractures and also some spinal curvatures like scoliosis. Some of the patients come to me because they get injured, and the number one thing that I always recommend doing is something called RICE. RICE stands for rest, ice, compression, and elevation. This is the most common treatment for injuries, especially when the patient has a sprain. It is important to do this treatment around the first 24 to 72 hours after the injury has occurred. Some of the more serious cases that I see are patients that go through some surgery and they need extensive physical therapy due to their injury and the surgery itself. One of the injuries that I see are ACL tears, and the patients go through something called ACL reconstruction surgery. Once the surgery is complete, when the other patient, I always have to assess their ROM, or their range of motion, just to see what kind of exercises I can do with them and how long the treatment plan has to be. Another thing that I see with patients are closed fraction reductions in patients with external fixations. The reason for the closed fracture reduction is to align and stabilize the broken area. And the external fixator are basically metal rods and pins that are attached outside the skin. The reason why we use the external fixators is because we're trying to prevent to use a cast so that it'll completely immobilize the limb. So instead of using a cast, it's better to use the external fixator first. The last example that I see is some athletes with rotator cuff injuries. These athletes always have a tendency to throw a lot in their sport, and sometimes they overuse their shoulder muscles whenever they go through practice and they have like 4 or 5 games back to back. Even though this is a piece of my day-to-day life, I appreciate and take my patients the best way that I can. Try to treat my patients the best way that I can so they can go back to play their favorite sport or to just put them back in their day-to-day life. Being a pediatric physical therapist takes a lot of finesse and confidence in order to handle not only your coworkers and the patients, but also the parents that come with the patients. So I hope you guys enjoyed my little day-to-day life. Thank you guys.